Hi, Dr. Randy Grill, nursing home dentist, to talk about why mom's denture is loose. And the reason I say mom is you've heard in other videos, most of my patients are females, upwards of 90 to 95%. In private practice for over 2 decades, had a denture clinic, made a lot of dentures, worked on lots of seniors. If you've heard in my others, I was on the board of directors of several senior centers and just enjoy working with seniors, always have. Most of my problems when a person can walk in a dental office with a lower denture were, boom, you did a reline or made them a new lower and things were happy. You know, once in a while they didn't work, but it was rare and there was usually a reason, tender skin, but it wasn't very often, so it's really not even on the radar screen. But as we age, and once we're institutionalized with full-time care, the challenges increase. One of the things that we notice, first of all, in doing geriatric dentistry is muscle function orally goes. Then muscle memory goes. In other words, you do tasks, and so if you lose a lower denture, you lose the muscle memory for that denture. We do tasks, whether it's golf, take out the trash, and the way we put on the trash bag, it's almost always identical. How you brush your teeth, different things like that. So once a lower denture is lost, a new lower denture on a patient in an institution, depending on who they are, if they come in and they've just been there a couple months, great. We have a lot of success with that. But the longer they're there, the less exercise they get because they're now in a wheelchair. Different things like that create different problems. So we no longer have all the solutions that we did in private practice because our patients are different. They've changed. Macroglossia, a big showstopper. When our tongue thickens, you put in a lower denture, it backs up the tongue and hinders swallowing and breathing, and a lot of times the person just needs freedom and they kick the denture out. And that is very common, according to a old professor of pharmacology at the University of Iowa that talked to, that consults with the dental school there in Iowa, consulted in a Chicago meeting of the special care dentistry, that 2 major system failures, and that could be diabetes, hypothyroid, you name it, renal failure, all the different things. Like sometimes I often have 15, 20 diagnoses: osteoporosis, OA, osteoarthritis, you name it, peripheral vascular disease, cardiovascular disease, any of those major system, 2 of those, and or 3 major meds, and especially Coumadin or some of the vascular dilators thicken the tongue. And how we treat swollen ankles is we put a support hose on, we lay them horizontal, and we squirt all the liquid up to the tongue, which is the next most vascular muscle. So macroglossia is very prevalent. The older we get and the more meds we take and the more diagnosis we have, and those meds are keeping them alive, so we can't take them off the meds. And so macroglossia is often a showstopper because you put that in, it's actually a choking risk. A lot of people have speech pathology thinking it's from a stroke, and it's actually from the tongue thickening from meds. Now the treatment's the same. It's just, I would say there'd be a complication with macroglossia from health where the speech pathologist would just say, well, it's probably a stroke. Neither of us really know. We're guessing at that. But the results are the same. You still need speech therapy to retrain the tongue on how to talk. Inability to follow instructions makes it a showstopper to make new dentures. We can't get denture records. We have to have them accurately stop, do several things to help us. And hard of hearing does that, dementia does that, unwillingness to do it. It takes effort to help us in making a lower denture. So also, sometimes they just don't want the hassle. And I understand that because at one time I was a vegetarian, so I could fit into certain jeans and do cowboy dancing, 2-step competition and fit into certain jeans and have a certain look. I got married, and about 2 years into the marriage, I said, this is stupid. I want to eat meat again. And I did, and I'm real happy doing that. But at one time, it was worth the hassle to me to be a vegetarian, or actually not a strict vegetarian, but you know what I'm getting at. Different stages of life, you put up with different things that are important to you. Now it's important to you for mom to wear dentures, but it may not be important to her. Also, things like hallucinations. I had a patient today that threw away his upper denture because he had some hot liquid and it melted all of his teeth in his dentures, and so he threw them away. Well, he obviously doesn't have the cognition any longer to wear dentures. But the granddaddy problem of them all is if you go to wikipedia.org, Wicca, W-I-K-I-P-E-D-I-A, and you, in their title box on search, put changes produced in the mandible, that's the lower jaw, by age. Changes produced in the mandible by age, and it will explain to you what the major problem is in wearing dentures. This is a jaw that when the teeth were first removed, it's high like that. There's a nerve on the side. Well, after years of wearing it, that nerve actually comes on top of there. So every time they bite with that hard plastic of a lower denture, it hurts. It pinches that nerve. So this is what it was. This is what it is, and that's called a class 3 mandibular ridgotrophy, and that affects most people that have worn dentures for some time. And if I write that down with nerve exposure on there, that's a granddaddy problem. It's most of my patients cannot have implants due to their jaw is way too thin, their health. Even if they had implants, they may not be able to wear it, but that is the solution for a class 3 mandibular ridgotrophy. That just is a fancy word to say they wore it out. And it's why we can't do hip replacements sometimes on the same age group of people. My mom broke her hip trying to dance, didn't use her walker, had a little dementia going on. They couldn't replace the hip, so they fixed it, and that means she's in a wheelchair permanently. And she didn't like that, and she gave up and graduated about 3 months after that surgery. Well, maybe it was 6 weeks. I get confused with mom or dad. But anyway, this is a major problem, especially when the jaw goes flat. You put a lower denture in, it pushes that enlarged tongue back, and if there was a ridge there, it would stop it. But now there's no ridge there, and it just flies that denture forward. So this is just a few of the showstoppers on a lower denture as we get older. And as my dad said, take notes, sonny boy. If you live to be as old as me, you'll suffer these same things, and we will. So thank you. This is Dr. Randy Grill, Nursing Home Dentist.